As the world is today tackling diseases that are posing huge public health challenges, including the ever-present threat of emerging and re-emerging diseases, we at the Kenya Medical Research Institute, KEMRI, are actively at the forefront, making sure that our country, region and people are safe and in good health. We are carrying out groundbreaking human health research that's of great relevance to our local and global needs, and are proud to be ranked as one of the leading centers of excellence in human health research, both in Africa and the world.
Our greatest asset has been our scientists, our human resource. We have the highest concentration of scientists who have PhDs in this region and who are very highly dedicated towards research.
Our health research programs are supported by state-of-the-art research facilities and laboratories and a strong team of highly qualified and dedicated world-class research scientists working round the clock to identify, understand and find cures for diseases that remain a threat to the well-being of people around the world.
As the parent ministry to KEMRI, I can attest that we have a human health research institution that is capable to effectively tackle the responsibilities set before us, both as an institution and as a nation.
So we've got programs around non-communicable diseases, around One Health, which we're now expanding to include climate health. We've got biotechnology, we've got sexual, reproductive, adolescent and child health. We've got programs around infectious diseases and parasitic diseases, as well as public health and health system strengthening.
Among the priority medical areas our research teams are keenly focusing on include the new and exciting field of stem cell research that's offering great promise for new medical treatments, and the harnessing and application of biotechnology for the discovery and development of tools and strategies for use in medicine and healthcare, including vaccine development, diagnostics and genetic engineering.
We have a highly skilled research personnel in KEMRI, and it cuts across all the areas that need be. We have the laboratory, we have the clinicians, we have behavioral scientists.
Currently, we have been running a memorandum of understanding, which is a research agreement between KEMRI, Oxford University, and the Wellcome Trust as a funding agency. And this cycle goes in for 5 years and has been in existence since 2003 when the first MOU was developed. And the research has been done well within our center.
We are also carrying out clinical trials for new therapies, drugs and vaccines for diseases of great medical importance. Embrace the huge potential in natural medicine and drug research through the Dantu gene study. Our scientists are discovering exciting new medical facts about the Dantu blood variant that provides strong protection against severe malaria. Launched KEMRI Eldoret's Sports Science Research Center that is focusing on sports health research and will evolve into Sub-Saharan Africa's first anti-doping center, and we are actively training and mentoring the next generation of top scientists and researchers to provide solutions to the rapidly growing healthcare challenges facing the African region at our KEMRI Graduate School.
We offer unique programs that address the health challenges not only in Kenya but also in the region. We are all aware and we all appreciate the evolving health challenges in the country, and having programs which are well geared and well structured to address these challenges is very key.
A medical research arm of our country's Ministry of Health, the Kenya Medical Research Institute KEMRI was established in 1979 and is today one of the best human research institutions globally, with a formidable research culture that is robust, responsive and result-oriented.
KEMRI is a government institution. It is a parastatal under the Ministry of Health. We are supposed to work very closely with the Ministry of Health, which we do, usually in issues of disease control, in issues of surveillance, in issues of policy, whether it is informing the ministry about new research developments, whether it involves the issues of UHC.
our role in outbreaks and containing epidemics is very critical for the country. And we are proud of that we can be able to be here to support the country whenever there is an outbreak, an epidemic, or a pathogen that is of national threat or international threat.
As one of the largest biomedical institutions in Africa, KEMRI is effectively utilizing new and novel biotechnologies to tackle diseases of great public health significance, including malaria and the COVID-19 pandemic.
We seek to use modern science and biotechnology to discover, develop, and improve tools and strategies for disease diagnosis, prevention, and management. We also seek to improve understanding of biological processes of disease vectors. This includes issues such as interactions of pathogens and the vectors, as well as the hosts.
Biotechnology serves as the part of understanding the genetic makeup of either a pathogen or the genetic makeup of a microorganism, so that we are able to also isolate or maybe do a screening of this pathogen by looking through the genetic makeup of this pathogen.
With stem cell research promising great medical potential and expectation across the world, our new and modern stem cell research laboratory is a regional center of excellence and holds a lot of possibilities for the country and region for local availability of some vital therapies that use stem cells.
There's a high burden of non-communicable diseases, diabetes, cancers, cardiovascular diseases, as well as injuries resulting from accidents, and mostly from what we call the non-motorized transport, commonly known as the borders. And in those scenarios, stem cells come in handy to help in regeneration of diseased or deletion of the organs that may be affected. Hence, this is the future of medicine.
The state-of-the-art clinical trials unit at the Center for Respiratory Diseases Research has placed us at the forefront of conducting research for better yellow fever vaccines, new treatments for TB, including vaccine trials for infants and adults, and shortening of TB treatment from 6 to 4 months.
We've just been selected for a phase 3 vaccine study that's going to be vaccinating adolescents and adults. And the idea of this vaccine is to prevent people who are latently infected with TB from progressing from latent infection to active TB disease.
The center is also carrying out research and extensive drug trials for sickle cell, a disease that is of great public health significance and prevalent in western and coastal regions of Kenya.
Historically, there was a lot of malaria here, and with severe malaria, the sickle cell trait survived better. Hence, they're able to pass on the genes to the next generation. So that's why we have a lot of sickle cell disease at the coast and in Western Kenya. We've described sickle cell disease in our population, mainly within the children.
We have transformed our Human DNA Identification Lab, HID, into a leading laboratory in the provision of DNA testing services in the region, and we are currently using it to develop a vital mitochondrial genome resource for the Kenyan population.
We are collecting samples from all the ethnic communities and characterizing them with the hope that such a database will be used for forensic purposes in study of mitochondrial diseases.
With malaria remaining a major global challenge, particularly in our country and Africa, where huge parts of our population are at risk of the disease, scientists at the Malaria Research Unit are making use of great advances in biotechnology in the fight against the disease.
We're looking at the effectiveness of the available tools, diagnostic tools, and also working towards improving those that are found to be failing or not being effective. We're also coming up with newer treatment options, better drugs, cost-effective, affordable, and those that will do what they are meant to do in the right way.
We are also carrying out extensive research, clinical trials and surveillance at KEMRI's Center for Global Health Research, situated in Kisumu City, which is right at the epicenter of a malaria endemic region of Western Kenya.
One of the novel products that we are currently trying in Siaya is the use of monoclonal antibodies, which have been shown to be very safe in trials done in Malawi, and they are very efficacious, reducing malaria infections by as much as 80%.
Lake Kanyaboli in Siaya is a malaria transmission hotspot, and our scientists are supporting development of new tools for control of insect vectors of human diseases and evaluating new mosquito vector control products at the site using unique experimental huts that mimic a rural village setting. The scientists are also implementing the attractive targeted sugar baits trial project.
These are devices that are placed outside of houses, and what they do is that they have a membrane. Inside of that membrane is enclosed a bait, so a fruit matrix that has an insecticide in it. And so the idea is to attract mosquitoes towards the bait station. Mosquitoes then feed through the membrane onto the bait, and that kills them.
The Dantu gene study at our Center for Geographic Medical Research Coast in Kilifi is offering a lot of promise and hope in our efforts to finally crack the stubborn and painful puzzle of malaria in our population.
This gene has been found to be very strongly protective. So people who carry one copy of this gene have up to 40% protection against malaria, and people who carry 2 copies of the gene have up to 74% protection against malaria. These are very strongly protective effects.
We have an ongoing program, Broad One Health Endoxide Malaria Initiative in Africa called Bohemia, which is looking at one of the arsenal for malaria prevention and control. They're using ivermectin for mass drug administration, and it is believed that once individuals take ivermectin, then once the mosquito bites, they become toxic and the mosquito dies.
The Center for Clinical Research plays a vital role in development of drug therapies and vaccines for tackling priority diseases in our country and provides a platform for clinical trials in infectious, neglected, and non-communicable diseases.
Newer diseases are always a threat, and because we keep monitoring, we are able to prospect and say that what are the pathogens that are of threat to this country or to humans that can eventually cause epidemics.
Taveta is on the border of Kenya and Tanzania. And being on the border of Kenya and Tanzania, there's a possibility of diseases being transmitted from across Tanzania to get into Kenya, and some from Kenya to Tanzania. And in that process of the transmission, which we cannot stop, we need a research institution to be able to monitor some of the diseases that cross from the other country.
The surveillance program also aims at enabling us to have a better understanding of pathogens that are in wildlife, especially the bats, and to find out how they interact with humans and what public health consequences might arise from this interaction.
The Rosetta's aegypticus species so far is the only known reservoir of the Marburg virus, and also suspected to be a reservoir of the Zaire Ebola virus strain. And so it is really of interest for us to be able to continue to do surveillance in these birds to understand their importance for public health in this particular area and for the country.
Where malaria is, it is at a very good point, covering neighboring Ethiopia, Somalia, and Kenya. We will take care, manage, and control, prevent all diseases coming from the porous border. As you know, Ethiopia, Kenya, it has the porous border.
The center also hosts the National Cancer Registry at collecting data on all forms of cancer incidences and trends in Kenya, and is recognized as a center of excellence and a training hub for Africa in cancer registration. With mental health becoming a huge burden in the population, our scientists are developing therapies and policies to successfully integrate mental issues in our primary health care and general medical facilities across the country.
Aside from just quantifying how big a problem in the epidemiological research, we try and find out what are the risk factors. The importance of finding out risk factors is we are able to build interventions that specifically address those risk factors for the various types of mental disorders.
Our research centers in Busia, Kwale, Kisumu, Kilifi, Kericho, and Nairobi are developing innovative tools and technologies that are greatly reducing the burden of infectious and parasitic agents among the population.
Our biggest mandate is to conduct evidence-based research that is aimed at providing solutions for the reduction of parasitic diseases, infectious diseases, and other causes of ill health. We're also looking at, pathogens and vectors that re-emerge as a result of climate change, to map them so that we know their etiology and control them ahead of time.
Because of the research we are doing in fungal, and we were able to know how, when to control this disease.
HIV and AIDS are among these diseases, and our scientists have successfully established the first ever HIV genotyping program in the region. Our Kericho site is also participating in an innovative study that's focusing on earliest stages of HIV infection to help us fully understand what is needed to create an effective HIV vaccine. The Center for Virus Research is placed among the best in the world and has developed a national diseases surveillance and rapid response capacity that acts as an early warning indicator for viral disease outbreaks across the region.
We've been able to look at viruses of medical importance very closely. We have been able to detect outbreaks in the field like yellow fever, Rift Valley fever, dengue fever. We are also looking at the past to see what are the viruses that have been there in the past and what would happen in the future in case these viruses come back.
One of the things that we really have to be very prepared for is another pandemic that could come from everywhere, from us, from Africa, from anywhere in the globe.
We are in the field looking for exposure to other pox viruses because we are going to start conducting clinical trials for monkeypox virus vaccines. But before we conduct the trial, we would like to know whether people have actually been exposed in Kenya to other pox viruses such as monkeypox, smallpox, cowpox, horsepox, and so on.
And as the COVID-19 pandemic struck the world in 2019, we were at the forefront of our government's response in tackling the disease by coming up with innovative testing tools, policy, and surveillance.
We became interested in coronavirus, and because we already had the infrastructure for testing for infectious agents, we began to test for coronavirus very quickly, soon after it became evident that it had come into Kenya. And we established this program. We helped the government put up the program for the country.
Our research scientists have been able to clarify the burden of the highly contagious rotavirus and enteric bacterial pathogens that cause severe diarrhea among children below 5 years.
The study revealed that rotavirus was a leading pathogen. About 22% of moderate severe diarrhea in children was actually attributed. That means rotavirus was responsible for that amount of disease in Africa and in Asia. What that means is that it helped Kenya Ministry of Health and global partners to speed up and prioritize rotavirus vaccination for children under 5 years.
The Child Health and Mortality Prevention Surveillance Program, or CHAMS, is surveying and identifying the definitive causes of mortality for children under 5 years and is playing an important role in informing significant national health policies, strategies, and plans.
The CHAMS study was formulated purposely to provide a comprehensive understanding of main causes of death among children under 5, using what we call minimal invasive procedures.
Our researchers are also focusing on eradicating neglected tropical diseases, which are among the most dilapidating ailments in our country and tropical areas around the world. These diseases include bilharzia, trachoma, dengue and chikungunya, trypanosomiasis, leprosy, and leishmaniasis.
These are a group of diseases that have been classified by WHO
that have received less attention and funding and affect the poorest among our communities. WHO has actually earmarked 20 of these diseases for control and elimination with a 2030 target to do this.
Our team of scientists is also actively undertaking major research work that's aimed at development of new therapies and drugs and total elimination of these diseases.
Some of the research that KEMRI is doing through our team is to support elimination of the disease as a public health problem so that we don't have people developing this disease anymore. This is aligned to the World Health Organization, WHO, declaration that all member countries should put in place efforts to eliminate the disease.
Sakafu Bora Afya Bora Utafiti, or Sababu project in Kwale and Bungoma counties, is evaluating the impact of improved household cement concrete flooring intervention on enteric and parasitic infections in rural areas, especially on children under 5 years.
There are research that have been done that have shown that people who live in earthen floors, which is what is most in our rural, Kenya, they are more predisposed to enteric infections, soil-transmitted helminths, and jiggers. We are hoping that this intervention would help reduce jiggers, soil-transmitted helminths, and enteric infection.
The Eastern and Southern Africa Center for International Parasite Control, SACIPAC, is another important regional platform that's enabling us to exchange valuable information on prevention and control of parasitic diseases in our communities.
We do train and capacity build Ministry of Health officers from the region, Ethiopia, from Uganda, from Sudan, from Malawi, from Mozambique, on disease mapping, that is NTD mapping. We do train on lab diagnosis, and we also do train them on operational and implementation research.
A Center for Microbiology Research, it's playing a vital role in improving food safety and preventing and containing antimicrobial resistance of common diseases of public health significance, including cholera, typhoid, and E. coli.
The center has been very instrumental in terms of handling infectious diseases and outbreaks. The outbreaks that we have had before, like the cholera outbreak, the center also has been very instrumental in actually outbreak response, where we actually go out and test for any pathogens that are involved in outbreak.
With cholera outbreaks being endemic in Kenya and the East African region, KEMRI scientists are carrying out a research at Mukuru Informal Settlement and are coming up with new ways to manage and control cholera, typhoid, and enteric infections among the population.
A cholera study, which is one of the main studies that we've been doing within the Mukuru area. But in this study, we went further ahead and to be able to look at where could these outbreaks be coming from. What could be the source of these cholera outbreaks, the frequent cholera outbreaks. So in addition to the clinical samples, we also had two other aspects of this study. One was to check the behavioral patterns of the people around this area. And then we also had focus group discussions with the community members.
The center also hosts the Nairobi Center for Nagasaki University Institute of Tropical Medicine that together with KEMRI and NEC Corporation have developed a revolutionary digital biometric-based vaccination management system for newborn children in Kenya.
We are looking at ways where we can collect data, where we can help the clinician manage the vaccines themselves, where we can help mothers know when they're supposed to go for vaccines, and we can actually track the vaccination history for children.
We are also keeping an even closer look at fungal and related opportunistic infections and meticulously investigating antimicrobial resistance that is daily becoming a huge medical challenge.
There's a risk that if we do not do something about it, sooner or later we run out of antibiotics really to manage even very simple infections. Critical medical process surgeries, for example, even simple surgeries, organ transplant will actually become difficult if we do not do anything, not only to prevent but also control the problem of antimicrobial resistance.
Our scientists are also actively researching on other new scientific ways of tackling this problem.
In our lab, we take advantage of natural predators of bacteria. These are natural enemies of bacteria. They are viruses. So when we have a multi-drug resistant bacteria, we go into the environment and look for a virus that can kill it. And here we've been able to identify many of these types of viruses that can kill these multi-drug resistant bacteria.
We are also focusing our research on how to effectively treat respiratory diseases that are affecting our population. These diseases include TB, asthma, and bronchitis.
We focus on epidemiological studies, and this brings out how much of magnitude is the disease among our population in Kenya. We also focus on clinical trials, basically to understand which is the best treatment for some of the diseases we are having.
The Clean Air Africa Research Project Facility is certified as a Center of Excellence in Sub-Saharan Africa for monitoring air quality and is actively working towards preventing diseases that are caused by indoor pollution at community levels.
This country is losing 23,000 people each year due to exposure to ozone air pollution. But to make matters worse also, we normally have about over 1 million persons actually getting sick annually due to diseases related to ozone air pollution. That's why this project is extremely very important in the region.
We are making a remarkable contribution in health through our study of disease patterns across different population groups, nutrition, and developing methodologies and appropriate tools that are informing national and regional policies and addressing health concerns, especially in the area of micronutrients.
We have supported the ministry to determine the right standards to fortify salt. So the current salt you find in the markets in Kenya that is produced within the country is actually fortified with iodine using standards that were developed by this particular center.
We are also pioneering the Hekima project, or health kiosks in markets, on a pilot basis, a unique and innovative health service delivery module that's very successful in improving access to preventive care at community level by providing free screening services for cardiovascular disease factors such as obesity, high blood pressure, and diabetes.
The burden of non-communicable disease is rising up, and there is need for us to intervene to halt that rising burden. And in so doing, we chose to strengthen the primary healthcare system in prevention of CVDs, cardiovascular diseases, but through use of community assets such as markets.
Herbal and traditional medicine is another area of great interest to our research scientists. The Natural Medicine Research and Drugs Development Team is carrying out research to confirm the safety and efficacy of these medicinal products and developing effective natural medicines and drugs for use in management of various diseases in our country and the region.
We are key in assisting the ministry, of course, through the Kenya Medical Research Institute, in availing medicinal therapies which can be integrated into the mainstream healthcare system. And this can only happen when we have data, information, which shows that first, they are safe, and secondly, that they are efficacious at known doses.
The unique thing about this center is that our work is community driven. And some of the activities that we've been conducting, for example, in this background, you can see some plant that's being grown. This plant is called Cathalanthus roseus. It's a source of anti-cancer drugs. And this project aims to establish whether it's possible to grow this plant locally and have the compounds manufactured locally. We anticipate that one of the key outputs of this project is to support the local communities in establishment of manufacturing facilities for the manufacture of anti-cancer drugs.
We are very proud of our scientists' cutting-edge research in sexual, reproductive, adolescent and child health programs, It is having a huge impact regionally and across the world. This groundbreaking research has greatly influenced global policies on pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, for HIV, intravaginal ring, and the single dose of HPV vaccine for cervical cancer.
We were able to show that one dose is enough, just one shot. The World Health Organization took this data, and late last year they changed their recommendations to 1 or 2 doses for ages 9 to 20.
With our huge strides in human research, largely centered on people and communities that we closely work with, we are strictly ensuring that the rights of research participants at every stage of our research are always respected and protected.
We have a regulatory framework, which is the Scientific Ethics Review Unit, which supports making sure that the research we do with people is ethical.
Community members may have concerns about the research work that you're doing. By having engagement approaches and engagement platforms, you're giving them an opportunity to give you feedback about the research that you're doing, so that even as a scientist, you can conduct research that is meaningful, beneficial to that population, and the population also has an understanding of how they will benefit from the research work that you're doing.
The main objective of us doing all these activities is to protect human participants, or those patients, some people will call patients, who are enrolled in these particular studies. So our mandate is to ensure that their rights, welfare are protected at all times.
Our resource development and knowledge management team is synthesizing and editing the huge research knowledge and data that we produce into a language that our policymakers and practitioners are able to easily use, thus ensuring our communities and country are greatly benefiting from cutting-edge human health research.
KEMRI is an evidence-generating institute, and this evidence is important for the government, but it can only be useful if the policymakers are able to understand it. So the role of our department is to ensure that the information is translated to an understandable language for the policymakers, for them to be able to put it in practice and use.
Our success as a human research institution is driven by strong and creative partnerships and collaborations, both regionally and globally, with highly respected organizations, including the World Health Organization, Japan International Cooperation Agency, the Walter Reed Army Institute of Medical Research, Wellcome Trust UK, University of Washington, Liverpool School of Tropical Medicine, Henry Jackson Foundation, University of California, San Francisco, Washington State University, and USAID, among others.
We have about 117 collaborators who are working with KEMRI scientists to fulfill the mandate of KEMRI.
KEMRI, as a result of our cooperation on human capacity development, joint research, and exchanges, have now become a center of excellence in Africa, so that it is not only contributing to the health of the people of Kenya, it is contributing through third country training to the health of people in African continent.
We've been partnered with KEMRI for 44 years now, and we've had a very fruitful, collaborative, and productive relationship with KEMRI, with many important achievements around the areas of developing vaccines, therapeutics, and preventive medicines.
Every month and every quarter, we report to the Board of Management of the usage of all donor funds. And also after every 6 months, that is semi-annually, we prepare statements for the donors that are audited by the Kenya National Government Audit Office. We do this because we want to assure our donors that there is prudent and effective utilization of the resources, and also value for money for all the funds that are given to KEMRI.
We are also currently establishing a training hub for vaccine manufacturing and building our country's biomanufacturing capacity by working closely with the Kenya BioVax Institute to produce essential vaccines for Kenya and the region.
The support that you have been getting on vaccines from institutions like Gavi is ending in 2027. We have to actually do our own. for our sustainability. So that has given us a push that we need to be able to get into this vaccine space as soon as possible. And we have taken this in KEMRI as a top priority, especially right now with our formation of BioVax. We are involved currently in a new initiative that, imagine, if there is going to be a future outbreak of infection X, what will KEMRI do? What will the country do? We are working with the idea that there is going to be other outbreaks like COVID. We are working with other partners on an issue called the 100 Days Initiative, whereby we can be able to have a diagnostic or a vaccine for anything that is new within 100 days.
Through our elaborate schools engagement and internship programs, we are mentoring and training the next crop of the finest human medicine researchers in our research facilities across the country.
Our range of engagement spans primary schools, secondary schools, but now we also have university engagement. Within the university engagement platform, we mainly interact with them through the Young People's Advisory Groups. This is a club where young people are able to come and discuss science, critique the work, or critique the concept, or just generally give their views. So it's an opportunity to give young people, to involve young people in science by giving them a platform to have their say about the work that is affecting their lives.
With human health research at the core of our mandate, we are channeling our research findings into important policies that are positively impacting our community's healthcare, and also linking research work from our laboratories with the market by developing and producing world-class products that are specifically addressing given national specific gaps.
This facility is one of the facilities that can help this nation in case of medical emergencies that will require the use of health product and technologies, such as diagnostics and medicine.
These products include KEMRUB hand sanitizer, TB-Side, a decontaminant, KEMVTM transport medium, ready-to-use culture media, KEMCOV-19, the COVID-19 PCR test kit, and PlasmoCheck, a rapid malaria testing kit.
We have given a priority to research and innovation, which is our core business. Looking at the new innovations coming through, the new research fronts that we are opening, the new partnerships that we are opening, this will significantly boost the position of the Institute as a world leader in human health research.
Our commitment as a team is to continue to position this organization to be truly African, truly global, and yet providing solution to African problems in terms of health.
As local and global emerging health challenges become more complex today and demand an even more proactive and innovative approach, we at KEMRI are proud to be keeping our promise of ensuring better health for our people and communities through world-class human health research.
We are here as a frontline institution of national strategic importance. We always say that while our army protects against hostile nations and hostile people, KEMRI is here to protect the country against pathogens. Hostile pathogens or diseases are coming up.